Hey there, David Chesworth coming to you for another episode of Health Talk. I'm here at Hilton Head Health on the beautiful Hilton Head Island, and today I've got a very special guest. Her name is Dr. Robyn Pashby. She is currently the owner and director of Health Psychology Partners in DC. She's a dual-track PhD in medical and clinical psychology. She's got 20 years experience in clinical practice with a focus on eating, weight, internalized weight bias, anxiety, and relational concerns. She is an active member of the National Board of Directors of the Obesity Action Coalition and has been a research assistant professor of psychology at the F. Edward Herbert School of Medicine at the Uniformed Services University of Health Sciences. So I'm going to bring Dr. Pashby on screen with me. Dr. Pashby, did I miss anything about your introduction there?
I think that's a lot. You're aging me with my 20 years experience, David.
Well, that's great. That's great. That means you're going to have a wealth of knowledge for our
That's
viewers
right.
today.
That's right. Wise with my time. Yes.
Yes. So I was wondering if you could start by just sharing a little bit about the Health Psychology Partners in DC that you started.
Sure. So we are a group health psychology practice. I have a team of 5 other additional amazing psychology providers. And we really all specialize at the intersection of physical and mental health. So we have a physical location in Washington, D.C., but we also see patients virtually all over the United States.
Oh, that's amazing. And so when did you start it?
So I've been in iterations. We actually just rebranded our practice in the last couple months. Before that, we were DC Health Psychology for about the last 7 or 8 years. But with the expansion of our telehealth footprint across the U.S., we decided to rebrand and sort of more accurately reflect our geography expansion.
Oh, very cool.
Yeah.
So one of your specialties that you mentioned that was mentioned is internalized weight bias. And I was wondering if you can explain a little bit about what that looks like and how it manifests.
Sure. So, I mean, I think anyone listening to this podcast or watching this podcast who has lived with struggles around weight will relate to the idea that the world treats people sometimes not so fairly and differently if you live with a larger body. And so that's called weight bias or weight stigma or weight discrimination, right? And it's basically this idea that based on how you look, essentially, the size of your body, there are stigmatizing experiences you have in the world. So what happens over time for a lot of folks is that when you live in a world that persists in telling you that you're not as good or that there's something wrong with you or that you're lazy or incompetent or all the other words, over time, those things start to creep into how you see yourself. And so internalized weight bias is what happens when really often smart, educated, people sort of start to believe things about themselves that aren't true based on the messaging that we've heard often from the time we're little kids, right? There's some data that kids as young as preschool actually show a preference for thinner bodies. So that's like, it's sort of in the water, if you will, right? Like it's really baked into our society. And so what happens over time is that people start to internalize that experience of being othered based on their body size and begin to believe about themselves that they are lazy or lacking willpower or lacking self-control or lacking discipline. Those are all the hot button words that people experience. And then that, of course, doesn't feel great, right? It has all sorts of consequences.
Yeah, no, so it's almost like just things, when you're a kid, you might get teased or your parents might say something, and over time, I guess it kind of influences your self-talk.
Absolutely.
Is that basically?
Even, I would actually say, David, I'll go even deeper than that. So self-talk, 100%, but more importantly, self-beliefs, right? Because the beliefs about ourselves are actually the seed which brings forth the self-talk. And so beyond the self-talk, it's like, why do people say things to themselves like, what's wrong with me if they gain 5 pounds? It's not because they actually, in that moment, think something's wrong with them. It's because these beliefs that sort of grow over time have taught them that something's wrong with you. And so I think internalized weight bias is trickier than just self-talk because it's much deeper. Yeah.
That that correction actually really resonates with me because which leads me to another question. I'm really curious to hear your take on it. So the affirmations is basically seems like there's different schools of thought around affirmations, and it seems like that there's probably more effective ways to approach it and less effective ways to approach it. And I wonder how important is it when doing affirmations or trying to shift your self-talk that when you're trying to change it, that you believe everything you're saying, because it seems to me like if you just like fake it till you make it, is that the right approach, to fake it till you make it? Or how do you change the way you believe about yourself?
So you just asked what I've spent 20 years understanding. And, I'll try to condense that in a podcast. Essentially, right? Look, do I believe that affirmations can help? Yes. But I don't think that they fix underlying belief structures, right? I think a solid therapeutic process is what helps change belief structures. When you sort of consciously decide to, let's say, step on the scale, which is a big trigger for negative self-talk for a lot of folks, right? And you decide to yourself, like, okay, if the scale is up, rather than launch into the whole, what's wrong with me? I'm such a failure. I can't do this. I'm going to change my self-talk to sound something more balanced, something like, look, losing weight is not easy. I've been working at it. And yes, I can feel disappointed about what I see, but it is not a reflection of who I am or what's in my brain or anything about my character. That's really important, right? That's a shift in self-talk. But if people can work on that self-talk for a really long time and not see much shift in those like underlying core beliefs, and those beliefs have to be adjusted very thoughtfully, I think, because a lot of times they're not just in you, right? They're like in family dynamics, as you mentioned. They're interpersonally consolidated in marriages or in friendships or in mother-daughter or father-son relationships. And so we have to look a little deeper than just how you talk to yourself.
So it's almost like with self-talk, if I'm going to try to reframe what you said, is you kind of try to reframe it in a less personal way, more objective, maybe more curious way, and that can help maybe mitigate the emotional response, but not necessarily change the way you believe about the underlying belief, which might require a deeper therapeutic process.
I think that's a great way of putting it.
Okay. So, does it really depend on the individual, or are there like key strategies with like what the therapeutic process would look like for changing your belief?
Yeah, so it does depend, right? I mean, I would want to know from a person, like, where do those beliefs come from, right? If it's a dynamic that has been, a person, let's say, gains weight postpartum, like after having a baby and going through perimenopause and is gaining some weight and really struggling with that, they might have a whole different belief structure than someone who has struggled with weight from the time they're 2 years old and have been told their whole lives that they are different, not good enough, don't fit in, need to go to a special store and need to do all these other things, right? So those are very different experiences. I'm not saying one is better, easier, or worse. I'm just saying that what the process is to sort of unfold that might look a little different by person.
That makes a lot of sense. So why do people, I guess, let me shift gears a little bit around emotionally eating, because I think that the same type of demographic, at least that we see here at Hilton Head Health, we see a lot of people who come here for weight management purposes, and a lot of them struggle with the emotional, mental side of it, and that's really been the bedrock of our program from the very beginning, is that change your mind, change your behavior, and fitness and nutrition are pillars of it, but without the mindset and the psychology of it, it's going to be more challenging.
Right.
But emotional eating seems to be a common struggle amongst people. Why do people emotionally eat, and why is it important to address that?
So I think I'll start by tying this into the first question.
Okay.
Internalized weight bias shows up, and there are plenty of data, by the way. This is not just my musings. There's plenty of data out there to support this, that internalized weight bias shows up in lots of different formats, psychologically through depression, anxiety, interpersonal struggles, low self-esteem, low quality of life. physically through poorer health, high blood pressure, like excess weight gain, disordered eating, and emotional eating. So to sort of tie those together, why do people emotionally eat? Some people emotionally eat because there's unaddressed internalized weight bias. It's not something that most weight management programs talk about. It's not something that, certainly any of the commercial weight management, apps or other things address, because it's such a personal, vulnerable, shame-filled experience that people don't want to openly talk about it a lot. But that internalized weight bias, which often shows up through things like getting on the scale and telling yourself what a failure you are if it hasn't gone down, is a trigger for emotional eating, because of course we know that eating food, often high carbohydrate or high sugar or high fat, releases a whole series of chemicals, right? Neurologically speaking, that help feel better in the moment. So when we're asking people to, delay behavior, to think about long-term consequences versus short-term reward and those sorts of behavioral strategies, those are awesome. But unless we understand what's triggering people to get there in the first place, and unless we understand what we're going to do about that trigger, for example, internalized weight bias, then we're basically just sort of trying to change the behavior without changing any of the things upstream of that behavior. And then, of course, that doesn't really work out so well for most people.
Gotcha. So in many cases, it's almost like a dopamine shot is what the food provides.
Right.
Temporary relief of whatever discomfort is being felt.
Right. And can you blame people? Right. I mean, if you think about it, first, life is hard, right? So all of us are stressed out and tired and all of that. World events are crazy and all of these things. But in addition, if you have lived with the messaging that there's something wrong with you, you just don't have the same resiliency to cope a lot of times with all the stressors of life without needing some extra help. There's no shame in that, right? It's like people need help, and food is a pretty low cost, pretty widely accessible way. Doesn't hurt other people mostly, right? So if you think about it, it makes really good sense from like a survival, like an evolutionary perspective.
And it almost seems like if you've gotten yourself to the point where you also have internalized it and you believe this about yourself, you might also follow the behaviors to reinforce that.
Absolutely. And that's what the data show us, that the higher people's internalized weight bias, the more likely they are to avoid exercise, to eat emotionally, to choose higher fat, higher carbohydrate, higher sugar foods. And if you think about it, like, okay, what's the why? Let's talk about exercise. Why might someone who believes themselves to be lacking in willpower or less than, why might they avoid exercise? Well, where do people exercise? A lot of times environments are not really safe spaces, right? If you go in there and everybody is in their, fancy sports bras and tight pants and things, it's like really not a very safe place to go and walk on the treadmill if you don't feel good in your body. So there's lots of very obvious reasons why these behaviors show up.
So what would be like I'm going to guess this also probably depends on the person, but what are some common themes and examples of like first steps people can take to address their emotional eating?
So I think, look, everybody knows the like, oh, don't keep it in your house, or put foods at eye level that are healthier for you. We know all of those tricks, right? How many of us have learned those since the time we were 5 years old? Don't eat in front of the television. There's all those things, right? And those all matter. But some people need additional help. And what I would think about in that case would be really looking at some of the mental health management, right? Like, is it anxiety driven? Is it loneliness driven? Is it shame driven? Why are people using food this way? Is it that there's an interpersonal issue? Like, I have so many people that come in, and one of the main triggers to their eating is their dynamics in their relationship at home. And until we start to manage those dynamics between, let's say, partners or husband and wife or something, it's going to be really challenging to change the only soothing behavior that people engage in. So this is where it sort of is like a longer term thing. And yes, those other sort of quick behavioral strategies really matter. But if people have been sort of like circling the drain around emotional eating for a really long time, then I encourage them to go talk to a therapist, because
Yeah.
often through therapy, you can start to really disentangle, like, oh, I'm not emotionally eating because I have chocolate chips in my house. I'm emotionally eating because I don't want to be, let's say, in this marriage anymore. And
Right.
that's a really scary thing that I'm faced with every night after 10 p.m. And I don't
Mhm.
really know how to cope with that feeling. And so instead of coping with that feeling, or thinking through that and taking action, I turn to food to sort of disconnect from it, to numb out, to avoid. Um,
Mhm.
and then, of course, other people struggle with more advanced disordered eating, right? Binge eating disorder and other things, which is pretty highly or underdiagnosed, because
Mm.
people don't really know, like, oh, emotional eating to this level is actually has a name and has a treatment for it.
Yeah. Oh, so our director of behavioral health, I think you know her, Ann
I
Poyer.
do.
Yeah. She often poses the questions in her workshops and seminars, what are you really hungry for?
Right.
And I don't think she made that up, but, and it's exactly what you just talked about. Is it hunger? Is it
Right.
anger, loneliness?
Right.
All those things.
And so one of the shortcut steps from a psychological perspective is really learning emotional vocabulary.
Hmm.
Because if what so many of my clients, who are, by the way, like some of the smartest people I know, come in and their vocabulary around emotion is like, I'm stressed, or I'm upset, or I don't
Oh,
feel good, right? I feel bad. And
so
that's
vague.
so vague, right? It could be a million things. And therefore, we don't really know what to do with it.
Hmm.
Versus, I'm lonely for social connection.
Mm.
Then suddenly the panel of options opens up to us, right? Do I call a friend? Do I write a letter? Do I go for a walk with my neighbor? Right? There's suddenly a more direct sort of line. But just this vague, like, stress thing, it's really hard to cope with.
Interesting. I hadn't considered that before. You're so right. I mean, I do that. I'm guilty of that too. Just saying I'm stressed or I'm tired or whatever. Just
Right.
very general terms.
Right.
And if
Right.
you don't actually pinpoint it, you probably can't really address it.
Right. So, for example, if a client comes in and says, oh, I emotionally ate last night, I was feeling really bad, or I'm feeling like exhausted or something. And what happens through the course of a therapy session is we might get to, actually, I was really disappointed that I had this big presentation. When I came home, my significant other didn't ask how it went. Right. So I felt invisible.
Uh huh.
Then suddenly we have a plan, right? Because we can actually engage said significant other in this discussion around, like, I felt really disappointed that you didn't, or I felt like you didn't care that I had this big thing go on, or
Yeah.
I felt invisible, and then, right. And oftentimes, well meaning partners are completely oblivious to this.
Right.
And so suddenly you get an improvement in the relationship. And of course, you get an improvement in the eating, because if you don't feel invisible, then you don't need to eat.
Right. Then you don't feel the emotion to eat isn't driving it at that point. Yeah.
Exactly. Exactly. Right.
Oh, that's so fast. So that actually reminded me of a small. When I started off as an intern here at Hilton Head Health almost 12 years ago, and I had a fellow intern who was very technical, and at the time it was kind of a pet peeve. But hearing you say what you just said, I think it was actually it's a very intelligent approach. So and I came into the office one day and I said, "Oh, you look tired," and she said, "It's not that I'm tired; it's that I'm fatigued." And at the time, I was like, "Come on!" But I get, it was a more specific version of tired, and I think it was really impressive actually how in tune she was with how she felt.
Right.
Yeah,
Which then, David, wraps right back to internalized weight bias,
yeah,
because if the conditioning and the messaging and the self-talk for your whole life has been basically avoid everything from here down, right?
yeah,
Don't look in the mirror, don't think about it, certainly don't try to, understand it, then we don't even understand what disappointment feels like in our bodies, right?
right,
We don't think about it like that. Whereas, I mean, certainly not always, but sometimes I'm able to say, like, oh, right, anger feels like really hot here,
mm,
right? Or here, versus sadness feels like that pit in your stomach,
mm,
or fear feels like the butterflies in your stomach,
yeah.
right? Those are different experiences, and they can tell us things if we listen.
That's so fast. So how common is it then in therapy that's like a starting point where it's just let's learn about how emotions affect you?
Yes.
Is that
Let's
pretty
learn
much
about
everybody?
emotions, right? I mean, there's a reason. Was it Pixar maybe that made that movie Inside Out?
Oh my God, I cried at that movie.
Oh my gosh, who didn't cry at that movie?
Yeah.
And why? Because we don't really teach anyone in
Hmm.
school about emotions, right? The closest we get is like the pain chart with like a happy
Right.
face all the way down to the really sad face.
How are
And
you, the magnet? How are you feeling
right,
today?
exactly, the magnet. And so I think it's something to be ashamed of if people don't have a vocabulary around emotion. It's not really part of our culture to
Yeah.
do that, right? We do have these catch-all phrases, and we're busy and all of those other things, but it does mean that there's room for most people to really do some work there and see huge gains
Hmm.
in how they're managing their food, how they're managing their health. Same with exercise behavior, right? It's not just
Hmm.
eating. So I want to go for a walk when I get home from work, but I'm stressed when I get home. And what does that actually mean? Who knows? It means all sorts of things for different people.
Yeah. Would you say that the emotional eating is common in both male and female, or maybe just expressed a little differently?
Yeah, I think, look, I the differences between genders is so, I don't
Nuance.
know, yeah,
Yeah.
whatever it is. What I see is that people of
People.
all genders, all sexual orientations, all of that struggle with recognizing emotions. And so we need to work on that no
Hmm.
matter what.
Yeah.
And there's certainly a societal pressure, right, for men to be tough or whatever.
Right.
But, for a lot of my clients who are very professional, successful women, there's that same pressure.
Right. Yeah. Absolutely. Where they're very career driven, or stakes are high, and
Right.
emotions are weak.
Right,
Right.
right. You can't
Whatever. Yeah.
cry in a boardroom, right? I
Right.
mean, and
Right.
and not be like broadcast all over the news anyway. So,
Right. Yeah. That makes a lot of sense. So a few times over this discussion, you've mentioned shame, and I'm curious what role shame plays in many of your clients' lives and in the endeavor against internalized weight bias, and what tools people can use to navigate shame.
mhm. Shame is one of the most difficult feelings that people express and experience.
Hmm.
And actually, when I'm training new team members that join my health psychology partners, I say, look, we all work with chronic health conditions. Many of us work in the world of weight management or disordered eating. All of us treat shame, really.
Hmm.
That's really what we're treating, because almost always people come in here knowing, oh, would it be better for me to eat carrots than chips? Yes, right? Like, would it be better if I went for a walk instead of watching a movie? Yes. Fine. Not that nutrition is not important. I love my dietitian colleagues. Not that exercise is not important. I was a
Right.
personal trainer for many years. I believe in it so much. But because they already know what it would
Hmm.
look like if they had to write out like their plan, right? Their schedule,
Hmm.
how they would eat, what they would eat, how much they would move, how much they would sleep, how much water they would get, how many relationships they would nurture, all these things.
Right.
But what is in that gap between what people know and what people do?
Mm.
The answer, David, is emotion. Emotion is in between doing and knowing.
Mm.
And a lot of times that emotion is shame. So, from my perspective, people already know what to do,
Hmm.
but they don't engage in it because they're busy managing shame to the best of their ability. And if you're busy managing shame, it's a little bit like, you know, you fall overboard and you're like struggling to get to the life raft, and someone is like, "Hey, while
Hmm.
you're out there, do you mind if you like, make your meal plan for the week?" You're like, "Okay, it's not that the meal plan isn't important, but I'm like kind of dying here, right? I'm
Right.
really struggling out here. So I can't really focus on that right now." So that's how I think of it. It's like people respect and need nutrition and movement and all of those important pieces, but not if they're struggling so much with this internalized stuff.
It makes a lot of sense. I mean, emotions can be so draining, and you can have the best of intentions and the best plan, and I mean, I often say this when I cover our motivation class. You can have the best plan, all the knowledge, all the resources, and you can still not feel like it.
Yes.
And a lot of times, if you're, like you said, if you're dealing with something as heavy as emotionally heavy as shame, it can be hard to get any willpower or motivation to do anything. So
it doesn't
what
even matter, right? It doesn't.
Yeah.
Yeah.
So how does one begin to, I guess, healthfully address shame? Because it's probably an inevitable human experience at some point that you have shame. But I guess it becomes a problem if you dwell on it, or if you can't get rid of it or move past it.
So one of the things that I have learned from my personal experiences and my client experiences is that the struggle with weight is very unique because people wear it, right?
Yeah.
And so if someone is struggling with other what our society says are shameful experiences, right? Like, oh, you, I don't know, like are, non-monogamous with your wife and you hadn't agreed to that, right? Or something like that. So in our culture, that's sort of frowned upon, right?
Right.
But you hide it. So you're not marching around every day wearing a T-shirt that says, this is what I do.
Right.
Right. But if you're living with weight struggles, often those are worn around with you every day. So you're constantly battling in your head, like navigating a world that is treating you a certain way and sort of dealing with like your own self-talk around that as well. And so I think it's challenging to address these things sort of just through self-talk. I think, again, a plug for therapy, right? Like having someone that understands what internalized weight bias is, having someone that understands how that shows up in your exercise behavior, your eating behavior and so forth, and your relationships is really important work.
Yeah. So the first step could be talking to somebody, a professional.
Absolutely. And of course, there's so many good resources on shame out there. Brene Brown popularized it, years ago. And I think her work is amazing because it basically normalizes the shame experience, right? And that's really helpful. And that's not often enough, right? A lot of people sort of understand like, oh yes, shame is a mutually shared experience. But when you're in it, when you're deep in it in that moment, it's really hard to care if Karen next door also has it, right? It just doesn't matter in the same way when you're like struggling.
Right. Would you say it's almost like blinders are put on and does shame contribute to feeling isolated?
Well, so yes, shame contributes to feeling isolated, and being isolated in our culture feels shameful. The shame of loneliness, being a non+1, for example, or feeling alone in an unhappy relationship, or feeling alone in a big family where you're lost, right? So yes, it's shame. The experience of shame can be isolating, but the experience of being isolated also feels shameful. So it's sort of reciprocal that way.
It's like it becomes a cycle when you get in it.
And I think, the motivation comment you made is so important because I think people are not unmotivated to eat better or move more, right? Or to sleep better or to have better marriages or whatever.
The desire's there.
The desire's there. The energy is there often, but that is all often being directed to a different motivation that is in some ways competing with the motivation to change. And that is to regulate emotion, because emotion regulation is like a primary driver for most of us, for most of our behaviors.
That makes a lot of sense. I mean, even when you measure like a resting metabolism, I think they say the brain takes up 60% of your energy needs, something like that. Most of your energy needs. So if your emotions are weighing on you, I can imagine that would probably take even more energy.
Exactly. And so many clients come to me, and I'm sure to you guys too, saying like, I really just want to lose weight, like help me with the, and I always say, it's like the equation, right? X plus Y equals Z. And all they want to focus on is Z, the outcomes.
Yes.
Right?
Yes.
And I'm like, we can't, if you don't change the variables that are contributing to Z, And some of those, by the way, are environmental, social, psychological, relational, biological, genetic, right? It's much more complex than nutrition and movement.
There's a few more letters in that equation for most people.
Yes, a lot of them. Right, exactly. And I also, full awareness here, that feels really overwhelming for people who are in that position where I said, like, they've fallen overboard, right? If you're really struggling and someone's like, well, we got to go, letter by letter here, it can feel so disempowering and so hopeless. Like, when am I ever going to make any change or make any headway on this? And so again, that's a plug to talk to someone about it, because it's certainly not hopeless. It's more hopeful, but in a realistic way.
Well, and it seems like, and this is something where I would defer to you to say if this is the right observation or not. It seems like if that doesn't get addressed, even if you do achieve X weight on the scale, you haven't addressed the shame, and maybe you lost the weight quickly, and you think that if you see that number on the scale, it will get rid of the uncomfortable feelings. But if you haven't addressed the feelings along the way, they're probably not going to go away, and you might gain it all back.
So there's so many factors that drive weight regain. The first and most primary is just simply biology, right? Our bodies want us to maintain a higher weight. It's biologically that way. So there is already that pull. And yes, if people haven't, everyone can do things for like a short amount of time, right? But weight management is a long-term, lifelong process of management. And so we do have to understand what keeps people going especially when, in that beginning time when people are losing weight, the reinforcement that we get, it's like another dopamine hit, right? You get a dopamine hit when you see the scale number go down, if what you're driving for is weight loss. But eventually everyone stops losing weight, and we hopefully go into weight maintenance, right? Yeah. And then suddenly that primary dopamine hit that we used to get, which is watching the numbers go down, disappears. And then what? Or people will say, I want to lose weight because my knees hurt so badly. Okay, so knee pain is a driving factor. But what happens over time when you maybe change your weight and start, working with a physical therapist and all these things, and then your pain goes away? It's amazing. And if that's the only reason you are engaging in these behaviors, then suddenly the dopamine hit you got goes away. So we have to think long term, like, what are the reasons I'm doing this? And that's to me why I so encourage people to think about the mental and emotional aspects. If you feel emotionally, for example, proud of yourself when you get to the gym, that is a reward. And that's there. I've been exercising for, 30 years or something. Like, it doesn't matter now or 30 years ago, I'm still darn proud of myself every time I do a workout, right? No matter if it's a 15-minute workout or an hour-long workout. Because I make a conscious effort. That's where self-talk comes in. I make a conscious effort to remind myself how totally awesome it is that I took time out to move my body.
That's such an interesting way that you just framed that, because one of the things that we talk about in our program here is the difference between external motivators and internal motivators, and that external motivators are like the I'll be happy when fill in the blank, and then internal motivators is like the reward is from the activity itself. And what you just described was when the dopamine hit happens, when the dopamine happens from the outcome, then that's external motivation. When the dopamine happens from the action that you did, that's a more sustainable dopamine hit.
Exactly. And those, and I think this is where I always say to my clients, like, if they always say, what's the magic, right? What's like the secret sauce or something? And honestly, what I say is consistency, with the huge flashing caveat that consistency is only achieved through flexibility, right? And so over the course, I'll use myself as an example because I give myself permission. I don't have to out any of my patients, but so over the course of the number of years I've been exercising regularly, I have gone through bouts where during COVID, I did yoga for 260 days straight. Why? Because we were all going out of our minds, right? I was awesome. This is something I can do. Other times I've engaged in training for a half marathon or a marathon. Other times I've been obsessed with spin class. Right now I'm doing Krav Maga. Cool. like, I don't know, I'm just doing different things, right? And if I, at some point, what happened along the way is like, oh, I kind of got burned out on doing yoga. If I had told myself this story with one of these like invisible rules that we have in our head about eating and exercise, that I have to do yoga to be fit or an athlete or whatever, then when I burned out on yoga, guess what happens?
Stop
right?
everything.
I stop. But instead, I'm like thinking flexibly and thinking, I just want to move my body. I don't care for how long. I don't care what I'm doing. I just want to move it. That's my ultimate goal. And so then 30 years passes because I've been really flexible in how I exercise, how often, or how much, or, you know, how intensely. Those have varied, right? Doing a 20-minute yoga class is very different than going out on a 10-mile training run.
I love, so what you just said, so consistent but flexible. Our director of education here, Bob Wright, you might know him too, actually. Yeah, he uses the term structured flexibility. So having a plan, and not beating yourself up if you have to adapt, be flexible, and basically that same message of fighting that all or nothing tendency that many of us struggle with.
Oh my God.
Yeah,
we all struggle with it.
Totally.
Right? I struggle with it, and like pretty much all I do every day is talk about this. So I don't expect my clients who are like running businesses and families and all these other things, right, who don't obsessively think about this like I do, to not struggle with it.
It's part of the human experience. Yeah.
It really is.
Well, and especially if the all or nothing approach has proven to be successful in one area of their life, but not all areas of their life.
Right. And that's where it gets tricky with weight too, because there's periods of time where all or nothing really works. Right? These sort of restrictive diets and things works if the only outcome you care about is weight loss. And so that's why I know you guys too, we work so hard to move people away from like a sole focus on the number on the scale or the pant size, right? Like this is about, and this is where I think mental health matters so much, right? You will feel less stressed out if you go for a walk every day of your life. You will get that reward, right? Whether the scale moves or not, you are going to feel better. And if you feel better, then doing all the other things so if we feel better, that's the emotion. That's what's in between what you know and what you do.
I love that. So if you can cultivate the emotions by doing something consistently that's realistic and flexible, you're going to shift your emotions to one that will move you more towards action.
Yes, it's more conducive, right? If you've just come back from a walk and you feel great and your son or daughter says, hey, do you want to go shoot some hoops? The answer is so much easier a yes than if you're like sitting on your couch doom scrolling your phone for the last 3 hours and your hips are sore.
So while we don't have a significant amount of therapy here on site here, we do have a lot of coaching. And I think what you just talked about really hits on the importance of SMART goals, and the R, realistic, and like it's setting a very realistic goal that you can definitely achieve, because when you achieve it, you're going to be more confident, you're going to feel better, you're probably going to do more.
Right. And so in therapy, certainly we set SMART goals, but what happens is then we're there to really dig in and figure out what happens when the SMART goal falls apart. Or why is it when you are with a coach, you say, okay, yes, I'm going to set a SMART goal of a 15-minute walk. That feels very realistic, very doable. And then I didn't do it all week. Why? Right? Why? And the why is often because of this whole slew of invisible rules in your head that told you the minute you said out loud 15 minutes, immediately told you not good enough, not long enough, not hard enough, not going to burn enough calories, doesn't matter, is going to take too much time away from the responsibilities I have at home. And so in therapy, what we do is we really pick apart all of those things. Like, what are the belief structures there? What are those interfering thoughts? Because we have time to do that, right? We have time to like dig in. And I mean, I love pairing therapy and coaching.
It seems like a brilliant approach.
It's amazing.
God, that example you just gave is so interesting, because someone with that thought process probably has an all or nothing mindset, because if it's not the 30 minutes of the hour, why bother? because 15 minutes, if it doesn't matter, is now too much time and it's taking away from other stuff in my day.
Exactly. And here's the funny thing. Probably 99% of my clients will say, I understand intellectually that something is better than nothing, right? But emotionally, that is not the case. Emotionally, it's got to be all in, right? And so intellectually, like, I think coaching, what I love about pairing them is coaching can really get at the intellectual. And a lot of times what we do in therapy is really get at what are the emotional barriers to engaging those things that you set with your, your dietitian or your personal trainer or your health coach or other things. Like, why not? Why, what are those interfering beliefs about yourself, for example, like self-worth? Like if you decide that you're going to take time off to exercise, take time off of your family responsibilities, you have to believe that you're worth that. You have to believe that your worth matters as much as the worth of your kid or your spouse or your boss or your whomever. Or your, ill family member in a lot of cases, right? And those are really hard things to balance when the pressures of the world can feel really intense.
You can almost convince yourself that it's selfish to take care of yourself.
Absolutely, yeah.
Well, I'm really curious to shift gears a little bit. I was looking at your website a little bit before our interview, and I saw a video where you referenced weight loss medications and how you've worked with people who use them or who are on them, and how they might be the right tool for some, and depending on the person. But I'm super curious because it is newer to the landscape, and we're all kind of watching at the same time. But from what you've seen in your one-on-one settings, I'm curious what you've witnessed. If you've witnessed weight loss meds having more of a positive impact or negative impact on individuals' health journeys.
So, of course, my answer is both. And there's a variety of reasons. So, positively speaking, the reduction, as you've probably heard, of food noise, for example, is one major reason, right? Just the sort of relief that people feel from being constantly bombarded by, what did I eat? What am I going to eat? What's there to eat? Should I eat that? Did I eat too much? Will I eat too much? Is that the right thing to eat? Just sort of constantly going. So that relief is huge.
Even just hearing you say that is a relief to me. It sounds so relieving.
I gave a talk recently at the Academies of Sciences, and I shared like that sort of bombardment. When that goes away, I'll just, even like when I change my voice, right? If that goes away, the peace, the quiet, the calmness that people feel far outweighs the weight. That is a huge piece of the puzzle for many of my clients. Now, there are many other things going on, right? Where people with history of disordered eating can be really not okay for them to just be sort of randomly prescribed meds, right? People with a strong drive for thinness, that can be problematic because if the medications completely take away your appetite, which doesn't always happen, but can, that can almost be risky for people. Also, not everybody has the weight outcomes that we see on TikTok or something. There are side effects, and they are real, and people have to understand that these are not meant to be quick weight loss medications, right? These are really, in the science, what we call them is anti-obesity medications, and they're really medications used to treat the chronic nature of having excess adipose tissue. And if we think of it that way, it becomes a much more real conversation. If someone has chronic hypertension, for example, you want to give them the best treatment possible to manage the hypertension because you know that consistently untreated hypertension contributes to all sorts of other problems. And so when you have consistently high levels of adipose tissue that is untreated medically, it can result in all sorts of problems in the long run. And so that's what I think of the GLPs and the other medications as really being a target for. And then there's a whole bunch of psychology, of course, involved in using them. There's a whole bunch of psychology involved in if you do lose a significant amount of weight and sort of identity shifts that happen, relationship shifts that happen, self-image that changes. And then the reality that we are in right now in May of 2024, when we're recording this, is that there's a major supply issue where people can't even get them if they have a prescription. The costs are astronomical for a lot of folks. Insurances don't always cover them. Even if insurance covers it, they have a prescription and all of that, not being able to access it is a problem. I just had a client reach out to me yesterday who is living in another country and went to her doctor to ask, and the doctor's like, we don't do that. Like, basically sort of, sloughed her off. And she stood there and advocated for herself, but she was hurt by those conversations. So being on a med means you have to have a conversation with a medical provider about it. And that can bring up a whole bunch of stuff where you don't know who you're going to be interacting with. Is the doctor going to know that you're someone that has been working on this, or are they going to just go tell you to lose weight on your own? Or there's all sorts of stuff.
Not all doctors have the same bedside banner.
Okay. Not even close. Not even close. Yeah.
Isn't there a certain credential that physicians can get to show that they are more versed?
So the ABOM, the obesity board certification for obesity medicine, is the sort of the gold standard. But and ABOMs are certainly better than not ABOMs. But even within ABOMs, we have personalities, right? And we have PS. Doctors have beliefs too. And doctors have their own biases, right? In the same way we have internalized bias as a patient, doctors have bias, and they have internalized bias, and they have their own life experiences that inform how that interaction goes. So
I think you're right about that. I think sometimes people look at doctors as maybe walking textbooks, but they're also people with emotions and biases and thoughts.
Yes. And we have to, as a patient, it's not your job to help a doctor with that, but you can definitely sort of put in perspective, right, that this person is coming at it with this. And then behind the scenes, lots of us, myself included, are working really hard to make some changes to the medical
That's
education
great.
system.
That's a really noble thing you're working on there. Dr. Pashby, this has been an awesome time together. I feel like I could ask you so many more questions, but it seems like the moral of the story is increase your emotional literacy, your self-awareness, and probably if you struggle with a lot of these things, it's worth talking to a therapist, working with a professional.
I think that if I could share anything, it's this idea that mental health has as much stigma behind it as weight. Yeah. And so for people that have struggled with weight and mental health conditions, it's sort of what we would say a double whammy, right? And so I hope that people will hear from people like me and know that I'm not some scary, I'm just a real person too, who would challenge you to think a little bit differently about yourself, to think a little bit differently about the world, maybe to understand your own emotional landscape a little bit more deeply. And then from there, from a safe place of healing, real change, it happens. I see it every day.
That's so interesting. Why do you think that stigma exists, the stigma of seeing a therapist? It seems like maybe it's getting better over the years, but I think you're right. I think it's still there. It almost seems like it should be thought of as a good thing that you're trying to get yourself better. But where does that stigma come from, you think?
It's all shame-based, right? I mean, in our society, this whole idea of having your act together, whatever that means, is valued. And so if you need help, no matter what kind of help that is, there's some sort of down your nose looking when it comes to mental health or things that have a societal belief of like, oh, you should be able to do that on your own. I'm hoping that I'm helping sort of transform the landscape around that so that people understand brain health is no different than like, bone health. That makes else.
Like you wouldn't shame someone for going to see a doctor for breaking their arm. We'll have to have you back on sometime. This has been so informative.
I would love to. Maybe I'll come down and visit
even better.
sometime.
We can do one in person. All right. Thank you so much.
Thanks, David.
See you next time. I hope you enjoyed my conversation with Dr. Pashby today, talking about the role of shame, emotional eating, internalized weight bias, and we talked a little bit about weight loss meds, the role that they play. Hope you got value out of that. At the end of the day, remember, these podcast episodes are for you. So be sure to comment, send us a message. Who else would you like to see us interview? What other subjects would you like to see us talk about? What questions do you have that you'd like us to help you get answered? At the end of the day, this is for you. As always, thanks for joining us. We'll see you next time.